Welcome to the MediByte channel. I'm a healthcare professional here, and honestly, I am so incredibly thrilled you're joining us today. We're going to dive right into something really important, the risk factors for pregnancy complications. Now, I know the phrase risk factors can sound totally intimidating, maybe even a little scary, but let's reframe that right now. Think of this explainer as your comforting, empowering roadmap for a completely safe and healthy pregnancy journey. See, our whole philosophy here at MediByte is that understanding your risk factors, it is never about fear. No way. It's entirely about having productive, informed conversations with your doctors. Because when we know exactly what to look out for, we can monitor, manage, and very often completely mitigate these risks. Proactive knowledge, quite literally, is your absolute best tool. To keep things nice and organized for you, we're going to walk through 4 main health pillars today. We've got physical traits and history, managing medical conditions, external exposures, and finally, RH incompatibility. Just consider this your personal clinical checklist. All right, let's jump straight into pillar 1, physical traits and past pregnancies. So it turns out that opposite ends of the maternal age spectrum carry some pretty distinct risks. For instance, about 13% of all pregnancies happen in adolescence, and they often face risks like preeclampsia, anemia, and preterm labor. A big part of this is actually because they're just less likely to get early medical care. Now, on the flip side, for moms aged 35 and older, the risks shift a bit toward things like gestational diabetes and chromosomal abnormalities. But hey, with age comes proactive medicine, right? Doctors can use amazing tools like genetic counseling and high-resolution ultrasound to monitor older mothers every single step of the way. Right alongside age, a mom's pre-pregnancy weight is another big baseline factor. Being underweight actually increases the risk of having a smaller underweight baby. Meanwhile, being overweight or obese raises the chances of having a very large baby, which, as you can guess, can make delivery pretty difficult. It also ups the risk for preeclampsia and the need for a C-section. But here's the good news. To help manage all of this, doctors highly encourage aiming for about 150 minutes of exercise a week. Spread that out over at least 3 days, pair it with a healthy diet, and you're off to a great start. Definitely chat about this at your very first prenatal visit. We also kind of have to look backward to look forward, you know? If a woman has had a complication in a previous pregnancy, say a miscarriage, stillbirth, preterm birth, gestational diabetes, preeclampsia, or maybe the baby was in an abnormal position like breech, well, history can sometimes repeat itself. But here is the truly empowering part. Because your medical team knows your history, they are already on it. Spotting these patterns early means your specialist can break out the high-resolution ultrasounds and advanced genetic testing right from day 1 to keep a super close eye on this pregnancy. Okay, moving right along to pillar 2, managing medical conditions. So if a mom has pre-existing conditions going into this, things like high blood pressure, diabetes, kidney disorders, heart failure, sickle cell disease, or even sexually transmitted infections, it is so incredibly important to get into the best physical condition possible before conceiving. Look, pregnancy is a marathon, it really is, and you want to be at your absolute starting best. Managing these conditions usually means bringing in an interdisciplinary team. Your OB might team up with a specialist for your specific condition, and maybe even a nutritionist to make sure you're getting comprehensive, top-tier care. Now, sometimes issues pop up that are entirely unique complications. These are caused directly by the massive physical changes of pregnancy itself, not your past health. For example, the placenta might end up mislocated, we call that placenta previa, or it might detach prematurely. Then there's cervical insufficiency. That's basically a weak cervix that tends to open up way too early as the baby grows. Again, these are just things triggered by the biological process of growing a human.
And of course, these risks definitely compound when we're talking about multiple gestation, twins, triplets, you name it. Interestingly enough, with the rise of assisted reproductive technologies, having multiples is way more common now. But carrying more than one baby does bring unique high-risk factors, like preterm delivery, underweight babies, and placental abruption. That's exactly why these pregnancies are monitored super closely, starting with some really critical first trimester ultrasounds, just to make sure both the babies and mom are thriving.
All right, that brings us to pillar 3, external exposures and toxins. In the medical world, we use a specific term for these, teratogens. Teratogens are basically substances or conditions that increase the risk of birth defects. And the absolutely crucial window you need to be aware of, that's between 2 to 8 weeks post-conception, which works out to about 4 to 10 weeks after your last period. Why then? Because that is the exact window when the tiny fetus's organs are rapidly forming. It's a busy time in there.
And teratogens aren't just chemicals. They actually include dangerous infections too. Illnesses like rubella, Zika virus, syphilis, toxoplasmosis, CMV, and even chickenpox are considered key teratogens. But get this, even physical conditions can act as teratogens. For instance, exposing your body to high temperatures, anything over 102 degrees Fahrenheit from stuff like saunas or hot tubs during that first trimester has actually been linked to severe birth defects like spina bifida, so definitely skip the hot tub for now. Let's talk about one of the most common everyday exposures, mercury in seafood. The FDA actually has really clear guidelines on this. You definitely want to avoid high mercury fish. We're talking shark, swordfish, king mackerel. You can still have moderate amounts of things like albacore tuna, about 4 ounces a week. But here is a wild, surprising fact for you. While tilefish from the Gulf of Mexico have super high levels of toxic mercury and should be completely avoided, tilefish from the Atlantic Ocean, perfectly safe to eat. Crazy, right? Overall, though, you want to aim for 8 to 12 ounces a week of the safe, low-mercury options like salmon, shrimp, and tilapia, just to get those vital nutrients for your baby's growth.
Finally, we've made it to Pillar 4, understanding Rh factor incompatibility.
Which really begs the question, right? What actually happens if a mom's blood type doesn't match her baby's? Like, how does a mother's immune system interact with the blood of her own developing child?
Okay, let's break down the medical jargon here. It's really not too complicated. The Rh factor is simply a little molecule on the surface of your red blood cells. You either have it, which makes you Rh positive, or you don't, making you Rh negative. The specific incompatibility dynamic that doctors watch out for is when a pregnant woman is Rh negative, but her baby inherits Rh positive blood from the father. So the core danger here lies in what we call the sensitization risk. If the baby's positive blood mixes with the mother's negative blood, her immune system essentially sees it as a foreign invader and creates Rh antibodies to hunt down and destroy those cells. Now, the surprising fact? This mixing almost always happens at delivery. This means your very first pregnancy is typically totally safe. The real danger is actually to subsequent pregnancies. That's because the mother's now primed immune system can attack a new Rh-positive fetus, destroying its red blood cells and causing severe fetal anemia or jaundice. But don't worry, because modern medicine tackles this issue head-on. To completely avoid invasive procedures, doctors can now just do a simple maternal blood draw for a cell-free fetal DNA test to check the baby's blood type. It's amazing. If the baby's at risk for anemia, we use Doppler ultrasound to literally check the blood flow in the fetal brain. And if the anemia gets severe, specialists can quite literally perform life-saving blood transfusions into the baby while it is still inside the uterus, directly through the umbilical cord. Absolutely mind-blowing. They can also give corticosteroids to help mature the baby's lungs if an early delivery is needed. But even better than treatment is prevention. And preventing this disease is a wonderfully straightforward, highly effective step-by-step process. If a mom is Rh negative, she'll get targeted injections of Rho-D immune globulin. Usually that happens at 28 weeks, and then again within 72 hours after delivery if the baby is Rh positive. Think of these injections like a cloaking device. They literally stop the mother's immune system from ever making those dangerous antibodies in the first place. Problem solved. So, bringing it all together, I know the list of potential risks in pregnancy might seem a little long when we lay it all out like this, but the tools we have in modern medicine to monitor, manage, and mitigate them, they are remarkably effective. From simple lifestyle adjustments to advanced genetic testing and brilliant preventative therapies, you have an incredible safety net supporting you. Which leads me to ask you this. Equipped with this new roadmap, what proactive step will you take today to empower your pregnancy journey? Maybe it's finally scheduling that preconception checkup, or just having a detailed conversation with your family about your medical history. Whatever it is, take that step. Thank you so much for hanging out with me today. I really hope this explainer made you feel confident, informed, and ready to take charge. Please don't forget to like, share, and subscribe to the MediByte channel for way more accessible, empowering health content just like this. See you next time.